Now, I would like to invite on stage Dr. Sobha Shah. She's been practicing homeopathy since last 34 years. She has also contributed to editor of NJH and speakers in various national seminars and webinars. She has shared over 100 cases and articles in NJH over past 20 years. She is also mentor at Batras Academy. Her core interest is in treating deep pathological cases. Please welcome Dr. Sobha Shah.
Thank you very much for the warm welcome. So, good morning, Rajkot. Yes. Yeah. My PPT? Yeah, friends. So, before I start, I would like to pay my gratitude to our master, Dr. Samuel Honeyman sir, and all my teachers at NJH, Dr. Vishpala ma'am, ICR, Predictive Homeopathy, and HHF. Friends, the objective behind presenting this case of mine to you is it is a case of a T-cell lymphoma, the case of a blood cancer, the cutaneous T-cell lymphoma, the blood cancer which has its expressions on the skin. Now, I feel that, I am just like one of you. I want you all to make that feel that confidence within your own self. In the early years of practice, I remember that I have, refused to take such cases in my hand when the cases came of this type. And it is only after attending the seminars, when you are see Dr. Mayuri ma'am also has presented the cases, all other speakers, Dr. Praveen sir, Dr. Ketan sir, everybody has presented the deep pathological cases. It is the scope of homeopathy that you all must understand, that it is the scope of homeopathy. Homeopathy has lot of potentials, and we are the chosen ones being a homeopath, and we should not hesitate practicing homeopathy going further ahead. You all are the young generation sitting here, and I want to imbibe that confidence within you, seeing the results one by one in all the cases. So with this, I will just start with the case. This is a case of a 63-year-old male patient, and he came to me 6 years ago on 10th of January 2018. He is not much an educated patient. His other family members, like I know his brother, his sisters, they are all like sophisticated people, But this person, when he came to me, he was having a lot of unrefined qualities within his own self, like he wasn't that refined. And he has this complaint since 1 year. You see the look of him. We will see the further photograph of him also. His complete skin has become blackish and charred. And he was having a very sad, depressed and mayus look on his in his eyes and on his face. Yeah. So this complaint is there since 1 year, and his complete head to foot, the whole body was involved. His skin has become completely dark. It has become rough. It has become thick and dark blackish discoloration. There were a lot of peeling of the skin, and wherever the skin used to peel off, it used to leave the hypopigmented patches. So you will see it on the photographs later on. He has taken the treatment from the different dermatologists, but without any relief. Next. So what had happened is he had got a chest pain and he was hospitalized. So the physician under whom he was admitted, he saw him, and then he was also taken aback, and he took an opinion of a dermatologist. And the dermatologist came and he did a skin biopsy, and his disease was diagnosed as a mycosis fungoides. The mycosis fungoides is the most common form of a type of blood cancer called cutaneous T-cell lymphoma. Now, cutaneous T-cell lymphomas occur when the certain white blood cells called T cells, they become cancerous. And these cancers characteristically affect skin, causing different types of skin lesions. This is his biopsy report, and we can see in the impression that the findings are consistent with the patches of the mycosis fungoides. So it was scientifically proved, diagnosed case. Next. Yes, friends, these are the pictures of the patient. If you can see, then the whole his head to toe, the skin has become dark, blackish, rough. If you can see, there are deep cracks also, which you can see on the scalp. And they are deep and they are bloody. His hands, even the palm, not only the dorsum, even the palmar aspect of the hand is also involved. The skin has become dark, rough, and thickened. Next. See, look at the deep cracks which are seen on his fingers, on the dorsum of the hand, and on the leg also. And wherever the skin is peeling off, it is leaving the hypopigmented white patches. So his family consisted of his wife, 2 sons, daughter-in-law, and 2 grandchildren. He has 2 sons. The elder one is married. The younger one is unmarried, but he doesn't want to even get married. He is just refusing for it. So when patient was young, he was at his native place. He came to Mumbai when he was 12 years old, and he worked as an employee in his brother's kirana shop. So he didn't do any smart work. What he did was a work of a laborer type. As I told you initially also, like he is not a very refined type of person. That is what was my understanding about him. So after he got separated from his brother, he started his work of raddi paper and an old paperwork by collecting the raddi paper, but he was very hard worker. So with that, he earned good money. He bought 2 shops of his own, and he also constructed 1 house in his native place. Now, it is very important, friends, as a homeopath, to understand what is the conflict, what is the pain, what is the ailments from, why the patient has suffered such type of illness. So, and usually if we can get it on the timeline, it is the best. And most of the time, if we try to understand, we definitely get it. So when I asked the patient, okay, what is the tension? And especially before around 1 year, what was it? So that time patient said, tension is continuous. Tension is there at home, tension is of business, and my children are in Bangar. The younger son is BCom, but he doesn't want to do anything. And the elder son also changed many jobs and many work, but he is not yet settled. And both the sons again came back to the patient shop, raddi paper shop, and they are again into the Bangar work. And that is the tension. Now you being into the Rajkot, I think you are sure, I'm sure you must be knowing what is Bangar. Huh? What do we call Bangar? Right, the old iron scrap, which is discarded, which is useless. The people give it away into the Bhangar, into the Radiwala people, and then just discard it, which is of no use, and which is rusty, which is blackish, which is dirty to look at, right? So this is what the patient is saying, that my children are in Bhangar. This is what are the patient's words. It is very important. As a homeopath, you must understand what the patient is trying to say, what are the feeling state that he is trying to say it with. So when he is saying, when I sit with big people of society, they ask me what your sons are doing. And I cannot tell lies. I have to tell them they are still in Bhangar. And the people ask me, why they are in Bangar? No younger generation of today, of our society, is doing this work. Why your children are doing still this work? And patient is saying, because my children are disobedient. And they are the spoiled children. The first son, he quarrels with his wife. I tell him that you go out with your family, you take your children and your wife out. But he doesn't listen to me. And the elder son, he tells patient, okay, let us buy some property, property into some chawls and the slums. So the son is thinking that, okay, we will buy into the slums and chawls, and when it goes into the redevelopment, the money will get multiplied. But patient is patient is saying, if you want to buy, don't talk about slums and chawls. You buy in some building. according, even the second son is BCom. So patient had lot of hope on him, at least, okay, at least I am not educated, but at least my second son is BCom. It is he will do some job and better job. But the son also, the second son was not doing anything much. He also disappointed father very badly. So patient is saying he is continuously sitting on the shop and doing his, onto his mobile, not keeping the shop clean, and he's not much paying attention to the work also. And he uses cycle. I tell him, patient is telling him that at least you use the, buy a bike, but the son is not ready, who is BCom, he is not ready to even buy a bike when the father is offering. And that is again the pain of the father. So by nature, the patient is very much attached to his grandchildren. He has lot of, affection towards the family, and he satisfies all his demands of the grandchildren to an extent that he pampers them and he spoils them. And for that again his daughter-in-law and his wife again scolds him that why are you spoiling? But still he has so much of affection that he is not able to stop himself. He is very compassionate, also aggressive at times, but he is not worrying much about his complaints, and he is also a sort of little timid type of person. So now we need to understand and analyze this patient if we want to help him. So as a homeopath, it is very important to understand what are the characteristics in him. And what I felt was his skin, which was dark, charred, black, unhealthy with deep cracks, was one of it. His sadness and depressed look, and the next, his look, which was like, which, as I told you, which was not a refined look, that also I had taken it into consideration. And it is very, very important to understand the conflict and the pain of this patient. Now, the conflict of this patient is, what is he saying? My children are not yet settled, and they are still in Bangar. That is what is the pain of this father. And he tried hard to motivate these children to settle them in life, but he was disappointed. He feels ashamed, he feels degraded, he feels embarrassed. When he sits amongst the people of the society, he feels that he can't show them his face. So what the skin represents? Friends, it is very important, being a homeopath, to understand every case also into the psychodynamics. So when the expression of this blood cancer is onto the skin, it is important for us to understand the skin and its psychodynamics. So what does skin represent? We present ourselves to the world through our skin. Patient developed conflict in his show to the world. Thus, he got skin disease. Patient is disappointed with his sons. He feels ashamed, he feels embarrassed, humiliated, mortified, and he doesn't feel respected when he sits amongst respected people of society. So the question which was coming to my mind when I was taking the case, you are doing this Raddi paper work since last 20-25 years, and why did you get this illness since 1 year? Why are you worried so much about your children doing the same work when this work of Raddi paper has earned you happiness, has earned you livelihood, has earned money from which you could construct 2 shops, you could construct a house in the village? Still, why are you feeling pain on about this? So I asked him that, did you suffer any conflict when you were doing Raddi work by yourself? And he said no. He did his work very happily. He had just focused on his work that time, and he did not consider what people will say at that time. We say, no, sabse bada hai rog, kya kahenge? Exactly. So, no work is big or small. It is our perception to look at it determines whether it's big or it is small. He insulted and degraded the same work, telling it bhangar, bhangar. And nature turned his skin into bhangar, turning it into bhangar, blackish like a bhangar, and giving him such a deeper pathology like a cancer. So children are the extension of parents. Every parent expects their children to accomplish their unachieved dreams. They want to feel proud about what their children do in their lives. But here, the patient's this ambition was lost. So friends, the rubrics that I took, I have taken the mental rubrics because along with the skin, in this case we are seeing lot of characteristics on skin, but along with that, the patient's mind, whatever we have got from the patient is also very, very characteristic. So when we can combine both this and make the totality, it will give us more confidence to stand on a very firm platform. So the rubrics that I took was ailments from mortification. He felt ashamed and he felt embarrassed in front of society. He felt his position was lost. So ailments from position, loss of death, presentiment of settling his affairs must be. He felt that he must settle his children who were not settled in life was paining him very much. And he was feeling helpless. Ambition was lost and anxiety when in company. Also fear in crowd. Love for family, he loved his family very much. Cares full of. Anxiety family about, anxiety future about, and fear of misfortune. When he thought that his elder son was talking about buying the properties in slum and chawls, he felt that whatever money he has earned in his life, this son will, let it go, meaning it will get vanished. So, yeah, okay, I wanted to ask you, the remedy? Petroleum, yes. The remedy when we repertorized all this was petroleum. So the petroleum 30 was given, and it was given in the single doses weekly initially. Later on, for a shorter period of time, I also gave petroleum repeatedly, but then I didn't require to give it repeatedly for a longer time. Also, when you are treating the cases and into that physician's chair, there are many things which comes up into your mind. I felt that, whether only petroleum will be able to sufficiently take care of the pathology of cancer that he is having. So that is why, do I need to introduce any cancer nosodes? So I also tried to give the cancer nosode carcinosin 200 for 5 doses, but without any relief. See, if there is no similarity, there is no similimum, even Dr. Mayuri ma'am said, you do anything, you may get partial results, but you will not get the wonderful results and the exact good results until you prescribe the similimum. So the carcinosin did not help, so then I dropped that idea of going ahead with carcinosin and focused only onto petroleum. 30-200 was given, and the cracks started healing first, the burning reduced, cracks started becoming shallow, it healed completely. Let us see the next slide. His itching reduced, his burning reduced, his hypopigmented patches which were there, that went down. Even if I have tried to hide his identity, I have tried to put those black putties on his eyes, but you can still see that in the first picture he's looking depressed. The face is very much syphilitic if you see. Whereas in the second picture, the expression has changed and he looks more hopeful. The miasm also of the case has shifted from syphilis to psychosis. So you see the cracks and this thing which were there in the first 2 pictures and in the last picture. All of the hypopigmented patches also disappeared, the skin also improved such beautifully, and he got a good this thing. Next. Look at his hands, which were the black hypopigmented patches again on the hands also, that also. Next. Yeah, the palms. If you read petroleum in Materia Medica, you will see the ragged, chapped hands. That is what in the petroleum it is given. So, friends, don't forget to read petroleum from Materia Medica today itself after going home. Look at this. So, next. Yeah, next. Also, the cracks and fingers at the tip of the toes and the fingers, which is very, very characteristic in petroleum. And the whole of the cracks also have disappeared, the feet have become very much smooth. This patient is there with me since last 6 years, and it is not just that, I also waited, the whole thing got cleared in around 2 years, but after that patient is still coming off and on. He is coming for his grandchildren, and he is still in touch with me, and he is very, very much better, absolutely fine. There are no recurrences or nothing of that. So what is petroleum? Petroleum is again one of the carbon remedy, as Dr. Praveen sir taught us. But petroleum is from the crude dark oil with unpleasant smell. And petroleum is very important as a fuel. And it mainly contains the hydrocarbons. The way Dr. Praveen sir said, it has the contents of the sulfur, oxygen, nitrogen also in it. So it is not a pure carbon, but the petroleum is very different from the other carbons like calcarea carb, carbo-veg, carbo-animalis. They are the dull carbons and very dull, sluggish carbons, indolent carbons, whereas petroleum is a very active carbon and very excited carbon. So it has excitement, irritability with inclination to go to be angry and to scold. And petroleum has one thing which is very characteristic is it is very cowardized, and cowardized to an extent that they have no courage to express their opinion. Internally they must be boiling, they have a boiling anger, but they have no courage to express their opinion. Then there is a death presentiment of and must be settling the affairs. This is a single remedy rubric of petroleum which is very, very important, and you will be able to solve many cases on the basis of this one rubric. We see, it is, in this case, I had expressions at the level of skin. So it was easier to prescribe petroleum, but it is not always necessary that we will get it. We have to treat men in disease, not the disease in men. So from that principle, recently I had a case of a stroke, but in that stroke case also, the patient had the same conflict of settling his children. And there also I had prescribed petroleum with a wonderful result. So you will also get cases of ICU, when the patients are in ICU, but they are still worried about settling their affairs. There also you can think about the petroleum. So death presentiment of and must settle their affairs, single remedy rubric of petroleum. Also the skin, which is very dirty, hard, thick, rough, raw with deep cracks. So friends, there is a lot about the petroleum more, but because of the time, I would really want you all to read it deep into the deep materia medica and learn petroleum more. Thank you very much. Thank you Homeo Seminar. Thank you Rajkot. Thank you Dr. Kalpit sir, and thank you the whole team of yours Homeo Seminar. Thank you very much.